There are new reports of people in their 30s and 40s who have mild cases of COVID-19 being left debilitated or being killed by strokes. It's happening in communities hard hit by coronavirus around the globe. News 5's Cherish Lombard joins us now from her home to tell us more about this correlation.
In the New England Journal of Medicine, 5 COVID-19 patients under the age of 50 who suffered large vessel strokes showed up to one New York hospital just during a 2-week period. Prior to this, that hospital reportedly treated on average 1 patient a month in that age group with large vessel stroke. A growing number of young and middle-aged coronavirus patients seem to be experiencing the deadliest type of stroke, known as a large vessel occlusion, which can obliterate parts of the brain responsible for movement, speech, and decision-making. The thought is that COVID-19 is causing inflammation that triggers the formation of blood clots.
It causes an increase in infection and an increase in irritation in the vessel walls, which promotes clotting.
The exact reason doctors are seeing this happen more in younger adult patients is still being studied, but some medical experts believe the majority of younger patients are more resistant to the respiratory distress caused by COVID-19. So those patients may get through the virus's attack on the lungs and think they're well, but they may not be.
The longer you have that virus in your system and it goes unchecked, the more time it has to cause a problem.
Sheila Ross with USA Health says we may be hearing about more of these stroke cases accompanying coronavirus due to testing.
For a while, we didn't have the test to test. And so we don't know how many of these people that have come in were COVID positive.
Researchers are still trying to pinpoint the why, but what they do know is that many patients with true emergencies like strokes are avoiding hospitals due to fear of contracting COVID-19 there. But with a stroke, time is of the essence.
Stroke is not going to go away on its own. So if you have one sign or symptom, you call 911 and you get to the hospital. Some people can go 6 hours before the damage hits and is permanent, but some people don't have but 30 minutes. You lose 32,000 brain cells for every second, 1.9 for every minute. And if they're dead, you don't get them back.
The signs of a stroke are confusion, difficulty understanding, dizziness, numbness, severe headache, trouble speaking and walking, vision changes, and weakness. Now, experts seem to be learning new information about the novel coronavirus almost daily, and research is now underway through a review of strokes and other neurological complications in thousands of COVID-19 patients treated at medical centers around the world. Cherish Lombard, WKRG News 5.